The CDC took the unprecedented step of slashing the number of vaccines it routinely recommends for children. Our Dr. Jon LaPook is here to break it all down. John, great to have you here. So where were we? What changed?
What's new is that before today, vaccination against 17 childhood illnesses were suggested for everybody. And now there are three categories. First category, still for everybody, but instead of 17 down to 11, things like measles, mumps, rubella, polio. Second category are for kids who are felt to be at increased risk for whatever reason. The third category are vaccinations only to be given after discussion with a healthcare provider for things like flu and COVID.
So there are parents out there who are celebrating this in part because they've never really understood, why do I have to give my baby the hepatitis B vaccine before they even leave the hospital? So what do you say to them?
And I get that. It's very complicated to try to figure out the risks and the benefits, why it's so important to have a healthcare provider with whom you can discuss this openly and empathetically. That said, the American Academy of Pediatrics calls today's recommendations dangerous and says it can continue to give their own recommendations. Remember that these are federal guidelines, overarching, but it's the states that figure out and determine what the guidelines are on an individual state level. And that can differ from state to state. We did reach out to HHS to say about insurance coverage, will it still be done? They said yes, all three categories will still be covered by insurance.
Okay, so parents are going to have some options for themselves.
There are, but confusing time for sure.
Dr. LaPook, thank you very much. You clarified it for us.